Hi everybody, it's Dr. Newman, board certified plastic surgeon in Manhattan, Long Island, and Westchester. I want to talk a little bit about something called a diastasis recti, and this is a conversation that happens when we talk about tummy tucks and abdominoplasty. There are changes in the abdomen, or specifically in the muscles of the abdomen, that happen with weight gain, that happen with anything that causes what's inside the belly to get larger. Pregnancy is the most common conversation that we have here. And the idea behind it is that the front of your abdomen has no bones. The front of your abdomen is all muscle. So as you gain weight and lose weight, it affects the front of your abdomen much more than the back of your abdomen. In the back, you have your spine. So your spine restricts any growth in that direction. So any weight gain or any growth of the torso happens in the front, and it happens because those muscles are stretching and those muscles are moving. What a diastasis is that if you think of the six-pack muscles or the rectus muscles, those are vertical muscles that if you look at a female bodybuilder who's never had any kids, and if you look at those rectus muscles, you'll see how close together they are. You'll see the same thing in a male bodybuilder because he's never had kids, but it's a very small gap between those rectus muscles. And if you think of those rectus muscles and you think about how close they are, that groove that you see on the bodybuilder is a groove between these two rectus muscles. With pregnancy, as your belly gets bigger, these two rectus muscles kind of start to stretch out and separate. The tissue between these two muscles, the tissue that bridges across that gap, is tissue that has no elastic property. So you end up keeping that extra tissue. When I then see people after they're done having their kids or after they've lost a lot of weight, that stretched out muscle, that gap between the two rectus muscles, those two six-pack muscles, remains. And there isn't a thing that you can do about that outside the body in the gym or with exercise or with massage or anything. There's nothing that you can do that's going to take these two muscles and bring them back together. The only thing that you can do is physically on the inside, physically bring them back together and sew them in place. And that's kind of an essential part of what a tummy tuck surgery is or an abdominoplasty surgery is that when somebody has these muscle bulges, we're tightening those muscles or bringing those muscles back together, closing that separation or that diastasis. And by closing that, you now have a belly that's flatter and muscles that are now closer together. When I see people who may tell me that, oh yeah, with my pregnancies, I carried very low or I carried very high, frequently I'll see more of a separation in the upper part of the belly or the lower part of the belly. And when I do a tummy tuck surgery, you do it according to what the patient has. And some patients only require bringing those muscles back together in the lower abdomen, some people in the upper abdomen, and some people in both. But when you make that space between the rectus muscles smaller, in a sense, you're taking the belly now and not just bringing the muscles together, but you're bringing the whole belly in and flattening it. And kind of that distance from your back to the front, from your spine to the front of your belly, is now getting made smaller by repairing that muscle. So that takes the foundation of your belly and makes the foundation of your belly just much flatter. So when I then continue the tummy tuck and pull your skin down and tighten your skin over this flatter muscle part of your belly, I'm able to give you a much flatter result. And that's a result that you keep. That's not a result that changes unless you gain a lot of weight again or get pregnant again. You're really never going to go through those forces again that cause those muscles to separate in the first place. So a tummy tuck done well and kind of customized to your specific situation can give you a great result that lasts a long time. And it's a result that you really can't achieve any other way other than surgically.